Good evening, everyone. Welcome to Saliva Sleuths and welcome to the investigation. For those who are new here, I'm Heather Kenny, your lead microbial investigator here at Saliva Sleuths. I'm a biological dental hygienist with a passion for all things oral microbiome and helping to uncover the root cause of disease. I help practitioners understand and apply salivary diagnostics, guide them towards a more effective and patient-centered solution for improving their health outcomes for their patients. Tonight, we're looking at something many clinicians sometimes miss, not because the clues aren't there, but maybe because we're not trained to actually look in the right places. So a lot of what I do is help you read the clues, looking at salivary test results, identifying microbial patterns, and thinking through how to reduce that burden. But we're not going to stop there because the real question is, what created the environment to allow the pathology to exist in the first place? If the bacteria aren't the problem, what is in the evidence room that's leading to that imbalance? Think about this. What if it's the terrain that's shifting the situation in the beginning? Through hormonal imbalance, through gut dysbiosis issues, or mineral depletion. So the entire ecosystem actually changes and the microbes respond to that environment. So instead of looking at what's there, tonight we're going to be looking at why is it there. We're going to step into a deeper layer of the case profile today. We're investigating the terrain, and I couldn't think of a better detective for this investigation than our guest today, Amber White. Amber is an integrative health practitioner. She's also a biologic dental hygienist and an educator like myself who helps to connect the dots between oral health and the systems that drive it. She brings a root cause lens to everything she teaches and helps us understand not just what we're seeing, but why are we seeing it. So tonight she's going to walk us through how to identify and support a healing terrain so that we can move beyond just managing symptoms and start really changing the outcomes. So sleuths, grab your notebook, follow the clues, and let's get to it. Amber, welcome, and I want to thank you for opening up this case file today.
Thank you so much for having me, Heather. I'm excited to dive into this topic with all of you. I know some familiar faces here. Some of you I'm just meeting for the first time. So I'm very excited to be a part of this group. I'm just going to share my screen so we can go through a presentation. When we think about what's happening in the body, when we think about the oral systemic connection, a lot of times, for many years, myself included, getting out of school, we're really stopping at the mouth and not really understanding how the body impacts everything that's happening inside the mouth and vice versa. I know a lot of us are biologically trained now, so we really do understand these connections, which is amazing. But when it comes to the terrain, we think about, of course, the bacteria that Heather's talking about all the time, but the terrain really is the environment that those bacteria live inside of, right? And it really is what determines whether disease can take hold or our patients can thrive in health. And so, really, tonight we're going to get into how we can actually identify these issues and dysregulations within the terrain and how to really support optimal health for our patients or our clients. So, when we think about this, we always have to go back to terrain theory, right? Why does terrain based healing matter? When we're thinking about each individual, each human that we're working with, of course, every single one of us has our own constitution, right? Those are things that we may have predispositions to, right? We may have genetic predispositions. We may be more resilient in our nervous system. We may lean more into fight or flight. A lot of those predispositions we're unable to change. We can adapt, but when it comes to the terrain, we really can shift what's happening. This is something modifiable that we can actually transform and really optimize our patient's health. And as we go through the different layers of the terrain, we'll see that there's so many different things that we can do to support optimal health. We think about modern dentistry and medicine. We're really taught to identify those pathogens, suppress symptoms, treat isolated areas of the body. But when we think about the terrain, healing is different, right? It's not asking, you know, just what is the condition. It's asking what conditions in the body allow this dysfunction to take hold. What in the host determine that? So rather than just attacking the microbes, although sometimes we have to do that, we know that. But what is it that allowed those opportunistic pathogens to create dysbiosis, to create disease in the body? Right. So rather than strictly focusing on that, and many of you may have those patients or clients where you're doing everything right and those microbes aren't going anywhere. You might be using ozone, laser, all the antibacterials, but those pathogens are still there. So why? Why are we not able to bring homeostasis back to the oral microbiome? And that really comes back to the terrain. So, when we think about the terrain, we're really supporting the body's natural resilience, right? We create the conditions that allow healing to unfold, especially in oral airway health. This shift is essential because inflammation, congestion, infection often begin with systemic imbalances. And then we think about really the history of this. The concept of terrain theory traces back to Antoine Béchamp in the 19th century. He was a scientist that argued microbes only become problematic in a compromised host, right? He believed the health of the terrain and the internal environment determines disease susceptibility. We also had Pasteur, who was really well known for germ theory. So we focus on those external invaders. Yet they say on his deathbed, Pasteur is said to have admitted the microbe is nothing, the terrain is everything. And this perspective has major implications for oral health. It explains why some people get cavities, infections, even with impeccable hygiene, right? Right. Just wanted to make sure there wasn't a question there. Definitely feel free to drop your questions in the chat. But I want to start with what is the terrain exactly, right? Because we can hear this word, we think of it as environment, right? When we think of this, I like picture this like landscape. It really is the environment in our body, right? Your biological terrain is a sum of your internal systems working together or failing to. So, this includes things like mineral balance and cellular hydration, mitochondrial function and oxygenation, pH buffering capacity, lymphatic flow and detox pathways, immune regulation and microbial ecology, our nervous system state, whether we're in that fight or flight response or that rest and digest response. So, when these systems are supported, the mouth becomes a place of resilience. When they're neglected, we see disease even with perfect brushing and flossing, right? It really is taking on a whole new lens as to how we are seeing our patients, identifying different qualities, different things in our patient. It really starts at that initial intake when we're really diving into their medical history, and we're able to start connecting the dots. I know being a saliva sleuth, we're always looking to be a detective. I think that's one of the things that I fell in love with when I started on this biological dentistry journey, is being able to really understand that those traditional recommendations, that the things I had in my tool belt when I was first practicing, they're still important, but there's so many other things that we can look at. So we might see a patient present with bleeding gums, something we see all the time. Traditional dentistry might recommend more flossing, right? And I know I was guilty of that so often with patients. It had to be their flossing habits, right? But the truth is, when we think about it from a terrain based lens, right, we want to understand why are the gums bleeding? Why do we have that bleeding response? Why do we have that chronic low grade inflammation? Does it stem from systemic imbalance? Does it stem from other things like liver congestion, hormonal imbalance, vitamin K deficiency? So when we think about taking this shift, we're not being reactive any longer, right? We're not just reacting to what we see in the mouth. We're taking a step back, right? We start to slow things down when we work from this lens. And we really start to think about systemic healing. We stop managing symptoms and we start transforming the internal conditions that gave rise to them. So that really is one of the big important things is we really want to be able to look at our patients as the whole human that they are. And one of the most important things, and something I will always be saying, is our bodies are intelligent, right? They have the ability to self regulate and heal when they are given the environment, the tools, the information, nutrition to do so. But when they don't have that foundation stabilized, that is when disease, dysbiosis, dysregulation all come into play. We have the systems that shape the oral terrain, right? We know the mouth does not exist in isolation. It's constantly influenced by our digestion, right? We know digestion starts in the mouth. And when we think about impaired or dysbiotic gut dysbiosis, we think about nutrient malabsorption, we think about shifts in pH, we think about our liver and kidney function, which determine toxic burden, also can show up signs of hormonal imbalance, right? We think of our lymphatic system, which clears waste and regulates immune response. Of course, we think of that endocrine balance, which impacts bone density, saliva, inflammation, and circulation. We think of nervous system tone, which governs healing and fluid flow. And we also think of mitochondrial activity, which provides energy for regeneration and healing. So, if we're not taking these things into account, that is when we can start to see imbalances in the body and a body that struggles to self regulate and heal. When we think about the oral clues of a disrupted terrain, right, we always want to be thinking of the mouth as this diagnostic map, right? One of the few places that we can actually look internally in the body and see what's actually happening. So, of course, go back to bleeding gums, something we see every day, right? This can often be linked to poor bile flow, low vitamin K, estrogen dominance, right? There's so many different variables. Of course, if we have localized, we might be mouth breathing. There's so many different things that we're considering. We also think of those patients with chronic bad breath. We know bacteria play a role, right? We know periodontal disease, we're going to get that malodor, but it also might be a reflection of gut dysbiosis or liver stagnation. So we always want to be looking further. We want to take those saliva diagnostics and we want to also look at these other areas of health. Because it really is how can we get the full picture for our patients? And that's how we're really going to be able to help them optimize their health. Of course, decay, something that we're seeing, very often in practice, often due to low minerals or imbalances in minerals, acidic terrain, and stress driven saliva suppression. Jaw tension, right? Hearing that a lot more and more lately, I feel like, tied to trauma, sympathetic dominance, or we can also see different mineral imbalances that play a role here as well. Um, the mouth often reveals what the rest of the body is holding on to, right? This is where we're going to start to see a lot of those clues before any diagnosis, before even maybe a lot of symptoms our patients might have, right? We can start to see these oral manifestations in the mouth of hormone imbalances, thyroid dysregulation, autoimmune disease, so many different things. We can also start to take a look at the tongue and think about gut health and gut dysbiosis. There's just so many different things that we can look at, so many of those clues. And we also think of the mouth body feedback loop, right? Not only does systemic dysfunction show up in the mouth, but oral infections and stagnation can perpetuate terrain stress, right? So we think of that as those interference fields in the mouth. And this can be a lot of different things. It can be an infection that's keeping the immune system chronically activated. It can be dental materials that aren't biocompatible, so things like mercury fillings. It can also be mixed metals in the mouth causing galvanic currents, right? It can also be like a reinfected root canal or a root canal that's harboring some of that bacteria and endotoxins. There's a lot of different things this can be, right? That chronic low grade inflammation is something that's always going to perpetuate into the body. Right. And it's not about creating fear with our patients or clients. It really is helping them to understand the physiology, right? If we want deep healing, we must support both local and systemic pathways. And so when I'm working with a patient or a client, I'm always thinking about how do we involve the body in the healing process, right? Because we are only able to heal in certain states, right? We're only able to heal in parasympathetic, right? So if we have that patient who's sympathetic dominant, right? He has tons of oral pathogens, he's mouth breathing, right? Causing even more sympathetic dominance, right? How well can that body heal? Even if we're using the most comprehensive approach to the oral bacteria, right? We really do need to calm that nervous system down so we can actually clear out some of that. So that's something that we always want to be thinking about, right? And terrain-based dentistry, I actually had someone ask me, like, is this just a trend going now? Because I talk about it a lot, but really it's a return, right? When we think of holistic medicine and dentistry, right? That's the original medicine. That's the original, process that we followed. And things have shifted and we've isolated systems of the body. But the big thing is we're not abandoning science, we're actually embracing it more fully, right? So when we think of terrain-based dentistry, it honors the body's wisdom, right? That body's innate ability to self-regulate and heal. It views inflammation not as a mistake, but as a message, right? We know inflammation is something that our body uses for healing. It's that chronic low grade inflammation that's something that we worry about. And that's where disease starts to progress. It asks practitioners to think critically, holistically, and compassionately. So when we focus on the terrain, we stop asking, what's the best antimicrobial, right? And start asking, how can I restore function and flow within the body? And if you want to stop me at any time or if I'm going too fast, please feel free if anyone has questions. A core principle of this is true overall healing and true oral healing is an inside out process. If we want to prevent decay, reverse gum disease, support surgical recovery, we must work at the root, right? And the root lies in the terrain. So, when we're thinking about those patients and clients that we're treating, whether it be through any of these different pathways, right? We always want to think about how can we support the body's natural ability to heal. And some of this information may be through conversation that we get through our from our patients. Some of it may be by looking at a detailed intake form and some of it might be things that you notice because you're looking for the clues, right? And then you can ask better, more targeted questions to pull this information out from our patients. We think about mineral balance and nervous system regulation, right? You may have heard minerals are the spark plugs of the body, right? Minerals are catalysts for every major biological function. And so often we can see patients and clients who are very depleted. And this really comes into play even more so if we're doing any procedure that requires the body to detoxify. And so many things in dentistry require the body to clear things from it. And so if we're very depleted and we're clearing toxins, we're also pulling minerals at the same time. So, one of the big things with detoxification is our bodies are always detoxifying every second of every day, right? Some people have more impaired detoxification pathways. Some people have, genetic variants that disrupt their detoxification capacity. But we really want to think about one of the big things is when we are detoxing the body or we're doing anything that requires the body to actually produce more energy to clear, we always need to think about replenishing the body, right? Because a body that is being detoxified without replenishment becomes incredibly depleted and may oftentimes feel worse after procedures if we're not thinking about these variables, right? So when we think about minerals, they support enzyme activity, they maintain hydration, regulate nerve signaling, buffer pH, and enable detoxification. So without adequate minerals, oral tissues become more weak, defense drops, and healing slows down. So there's different patterns that we can look at with minerals to show how well the body can heal. Is the body in a state of conservation? Is it slowed down? Does it have a slower oxidation and metabolic rate? Or is it a fast oxidizer, right? Where we know that the body is sympathetic dominant and we need to work on the nervous system. So lots of different things that we want to be thinking about. We also think about stress and mineral depletion, right? So every time we experience stress, whether it be physical, emotional, environmental, we burn through essential minerals, especially sodium, potassium, and magnesium. Those are the three that typically get burned through the fastest. And over time, this leads to terrain collapse, right? So we're going to see low saliva production, dry or acidic oral environments, higher susceptibility to decay and inflammation, right? We all learned back in school, every cell in the body has a sodium potassium pump, right? So this is responsible for bringing things in and out of the cell, right? So not only will we have lower saliva production, but we're going to have lower cellular hydration, right? Those patients that you might see very depleted in sodium and potassium, those patients usually aren't sweating either, right? Because they don't have the right amount of minerals. So right there, we know one of their detox pathways is blocked, right? And so we'll get into that a little bit more. But something that we always want to be thinking about is how are we supporting every system? We think there's so many mineral patterns, and I'm going to just touch on some of them. So, a test that I run frequently is the hair tissue mineral analysis, which is a HTMA test. And it gives us a window into how the body is managing stress and what its healing capacity actually looks like. There's a lot of nuance to this test and there's a lot of different things to I'm just going to kind of touch on some of the big things that we can think about. We think about a low sodium to potassium ratio, right? This can be adrenal exhaustion, weak immune response, calcium shell, which is a pattern I see very frequently. And a lot of times it is due to emotional shutdown, grief, trauma, right? Metabolic slowdown. In this case, calcium shell, we're going to see an excess of calcium in the tissues, right? We're going to see an ability to absorb magnesium and oftentimes tied to that, low sodium and potassium, right? So we know the body is in this conserved state where it cannot heal quickly and efficiently, but it also is blocked from some of these different things like that cellular hydration. They probably have low salivary flow, lots of things that we're thinking about. We also see low zinc can be indicative of compromised digestion, which we know is going to be more nutrient malabsorption, right? Even if we're eating the highest quality food, if we're not digesting it, we're not absorbing and assimilating those nutrients. Also, can be tied to poor tissue repair. We can also see high copper linked to hidden infections, estrogen dominance, mold exposure. So, lots of different things that we can see tied to the minerals. Right? And how do these mineral imbalances actually show up in the mouth? Right? So low potassium, right? We already said every cell in the body has that sodium potassium pump. Low potassium, dry mouth, oftentimes poor buffering capacity, and more cavity prone saliva, right? Our remineralization capabilities slow down. So it's not just calcium, phosphorus, and magnesium, right? We want to think about sodium and potassium as well. They really all work together. That's the thing with minerals is they all work together. They either have a synergistic or antagonistic effect on each other. So it's not just about do we have too little or do we have too much? It's how are they working together and how does that affect the different systems of the body? Of course, magnesium deficiency. This is a super common one, right? We need magnesium for over 300 enzymatic processes in the body. And so many people are deficient, even if they're taking a decent dose, right? So we see this quite frequently. We can see jaw clenching, muscle fatigue, TMJ pain, right? We also, with magnesium deficiency, we're thinking about decreased remineralization capacity because, of course, we need calcium and phosphorus, but we need magnesium to direct those nutrients into the teeth and bones. We can see calcium dysregulation, right? Where we see that high tissue calcium. And a lot of times in that calcium shell pattern, those patients might be the ones who come every 3 months. and have heavy calculus buildup on their teeth. I had a client not too long ago who was seeing her hygienist every 8 weeks because her calculus buildup was extreme, moderate to heavy every 8 weeks. Sure enough, we found she had a calcium shell pattern on her test. And we're able to work on redirecting that calcium, bringing balance back to those core minerals. She also had tooth sensitivity and some generalized bleeding response. So within a couple months, glowing checkup at the dentist, right? They changed her recall, right? Sometimes it's not just a more frequent recall, it's why is this happening in the first place? What is allowing this to take place? Tooth sensitivity on all of the things. So, something that we always want to be thinking about. And that's kind of one of those tools that I was talking about in the beginning, where when we first graduate, we have this information, and I would have done the same thing in that case. We need to see you more frequently. But when we assess it from this terrain lens, we're thinking about what is allowing this person to calcify, right? What is allowing this person to build up this amount of calculus in such a short window of time? Because her hygiene was great. She's using all the right products, right? She's using the she's doing it all. And for some reason, it's still building up. And we were able to get to the root cause. So that was great. We also think of sodium depletion, right? We can see sluggish tissue perfusion, fatigue, oral sensitivity, right? If we are low in some of those core minerals, right? If we are low in sodium, potassium, phosphorus, or we have that dysregulated calcium, a lot of times we will see more tooth sensitivity generalized. So something that we can bring balance back there, we will alleviate some of that tooth sensitivity. We also think of saliva, right? Not just as the oral microbiome, but as one of the most powerful indicators of terrain health, right? Rich enzyme filled saliva reflects good mineral status and nervous system balance, right? And when we have that rich enzymatic saliva, those microbes aren't going to, like those opportunistic microbes aren't going to overpopulate the oral microbiome, right? We're going to have that homeostasis and that balance. We can see those patients that have sticky, thick, or low volume saliva often reflect stress, dehydration, adrenal burnout, right? And without proper saliva, enamel can't remineralize and pathogens flourish, right? So if we have either depleted salivary flow, which can be for a number of different terrain based reasons, or we have, right, that unhealthy salivary flow, that thick, sticky saliva, right? We're not always going to have like our natural remineralization capabilities, right? So if we don't have that, we're going to have these microbes populate, these pathogens flourish. And of course, we have to think about the nervous system's role in healing, right? The autonomic nervous system determines whether the body is in survival or repair mode. Most modern patients are stuck in sympathetic overdrive. Although what I see quite often, and this is something we can look at on a HTMA test as well, is we have those patients in sympathetic overdrive, and then we have those patients who most likely were stuck in sympathetic overdrive for so long that now they lean the other way, but more in the phase of like burnout, shutdown, freeze mode. And I see that quite often. I see it more so in women. And the big thing with our nervous system is we want to build resilience between those two branches because there's a benefit to both, right? Our bodies were so intelligently designed. But what happens is when we lean, and like I was saying in the beginning, our constitution, we're predispositioned to lean more towards one side or the other, right? But the biggest thing is building resilience between the two so we can be activated into that fight or flight response and gently come back down, right, to parasympathetic. And when we think about dentistry, we're thinking about everything that we're doing requires a healing response from the body, right? So if those patients are sympathetic dominant or they're more in that burnout phase, they need some type of support. And that can be a lot of different things that we'll get into. But, we think about if we are sympathetic overdrive for digestion, for nutrient uptake, We think of suppressed immune response, a lot of times chronic jaw tension, bruxism, right? Healing requires a parasympathetic state, one of safety, restoration, and regulation. And so if we can't get the body into that state, the body will struggle to heal. We also think about how stress manifests in the mouth, right? Signs of dysregulated nervous system in the oral cavity include that chronic clenching and grinding, inflammation without infection, where we see that chronic low grade inflammation that just doesn't go away, right? It could be those patients that you see where you're doing periodontal therapy and they just don't have the response that we expect, right? They just don't have that healing response that should be predictable. We still see that kind of low level inflammation. We can see tight tongue posture, restricted airway, poor gag reflex, dry mouth, or numbness, right? The nervous system doesn't just influence behavior, it shapes tissue tone, saliva quality, and immune surveillance. So we really always want to be thinking of the nervous system. There's not a plan that I create for a client or patient that does not include nervous system regulation and building resilience. And it's going to be different for everyone. It's going to be different for those people who are chronic fight or flight versus in that burnout side of things. But there's always got to be something that is restoring balance here. We also think of the jaw and stored trauma. If you've read the book, The Body Keeps the Score, right? Our body holds on to so much. The jaw is a common site for storing emotional tension, right? The jaw and pelvis as well, which I'm not going to get into tonight, but there's such a direct correlation, a direct link between these two. But both sites are places that we can store a lot of emotional tension and stress. It's closely tied to the vagus nerve, which regulates the parasympathetic state. So when we see that unresolved trauma often shows up as restricted craniofacial motion, tongue-tied tension, persistent TMJ dysfunction. So to release these patterns, we must create nervous system safety. Of course, it can be body work, fascial release, different things, but we always want to make sure the body feels safe enough to heal. When we think of the vagus nerve and the oral terrain, the vagus nerve connects the brain to every major organ, including the mouth. Right? So low vagal tone is associated with inflammation and low secretory IgA, slower detox pathways, dry mouth, and low saliva. So when we can strengthen the vagal tone, we can improve immune function, digestive resilience, and oral microbial balance. We think there's so many different tools to support the nervous system. I feel like when I first started in biological dentistry, which was, I guess, close to 9 years ago now, there was like two red light companies, but there was like a couple nervous system tools. And now there's a million. There's so many, and it's just finding the right things. When I talk to my clients or patients about nervous system support, I always want it to be something that they enjoy. I'm never going to tell a client or patient that they need to do meditation, right? That might not be for everybody. I'm always going to give them a list of different things that they can find what works for them because we're going to stress the nervous system even more if we're recommending that our client or patient is doing an activity that they don't enjoy, right? We always have to find joy in life and what we do for our health. So there's different things that we can do. If someone likes guided meditation, I'm all for it. Breath work, singing, gargling, those things will stimulate the vagus nerve. We also think of myofunctional therapy because it's going to restore proper tongue posture, tone, and function, right? And we know the palate is innervated by the vagus nerve. So if we don't have that ideal tongue posture with the tongue gently sealed to the palate, we're not going to stimulate the vagus nerve, right? Mouth breathing, the breath of fight or flight, right? So if the mouth is sitting low in the mouth, we know that the body will be more in sympathetic overdrive. We can also recommend things like craniosacral therapy, somatic release techniques. When I was saying that those patients or clients that are more predispositioned to parasympathetic, but to like that burnout level, I really love somatic therapy for those patients or clients. And there's some different programs that I can recommend. Dr. Ariel Schwartz is big in somatic movement, and she has some great videos on her website. There's another woman, the workout witch, who has like these programs that are very inexpensive and just gentle on the body, but really about building resilience back into the nervous system. We also think about mineral repletion, especially magnesium and potassium, right? We want to replete the body of these minerals because they are responsible for regulating our nervous system as well, right? So these tools calm the body, regulate healing, and enhance terrain stability. There's so many more than this. I just made a short list. There's also so many different devices now. There's the Sensate, Apollo Neuro, Pulsetto. I have both the Sensate and the Apollo Neuro, and they're great, right? I use those sporadically. I've heard the Pulsetto is amazing. So if you're one of those people, now we don't need to buy devices to regulate the nervous system, but they're an option. And some people like that, right? Some people like a tool, a biohack. I personally love it, right? But we always want to make sure that we establish healthy foundations and we're not just using these tools to kind of override everything else going on in the body. But I always think it's nice to have some kind of tool in your practice for those patients to really get them into parasympathetic before their treatment. Red light therapy is another great option. There's so many different devices now, like I was saying. There's even just like little wands that we can do. We can really find like a very affordable device for the practice. And we also think of HTMA as a nervous system map, right? HMA offers insight into stress physiology. So it doesn't just show us that the body is depleted or it has too much of something. It shows us how these minerals work together and reflect different systems of the body. So we can see something like high calcium, low sodium. Our patients might be stuck more in that freeze response. We can see that low sodium to potassium ratio, burnout, low resilience, right? Low magnesium and potassium. We can see depleted repair capacity. Right. So without regulating the nervous system, mineral protocols won't hold. And that's why every time I create a plan for anyone, I'm always including nervous system support. Right. And so why do we always start with regulation? Right. When the nervous system is dysregulated and minerals are depleted, the body lacks the safety and resources it needs to heal. Right. So before we detox, before we intervene, we must build a foundation of energy, right? So replenishing those minerals, safety, building that parasympathetic tone, and drainage. We need to make sure that the channels of elimination are open, right? And that's when we start to ask our patients, are they sweating? Are they going to the bathroom regularly? How well are they breathing in and out? Lymphatic system, liver, kidneys, all these different things we have to take into account. So when we think about the sequence of terrain support, right? We want to replenish minerals and hydration. We want to regulate nervous system tone, activate lymphatic and drainage pathways. And once we're through that, that's when we're able to begin oral and surgical interventions with systemic support. Of course, we're in dentistry and we know emergencies happen. In a perfect world, this is what it would look like. In many instances, we may have to do treatment, but we always want to factor in how do we prepare it, how do we support the body post treatment, right? So we know that it's never going to be perfect, right? This is ideal situation. What we would do when we have those emergency cases, we want to think about what can we do right in the moment and how can we also support after treatment, right? It's really not alternative. It's very strategic, really focused on biology and physiology. So, the foundation of all healing, right? True healing requires more than treating symptoms. It begins with the body feeling safe enough, supported enough, and strong enough to do what it was designed to do: restore, regenerate, and thrive. And that really does start with a stable terrain. We also think about drainage, pathways, and detoxification. So, detox versus drainage, what is the difference? Detoxification is the process of mobilizing and neutralizing toxins, but it's only safe when drainage pathways, the body's physical exit routes, are open and functioning, right? Too often, detoxification, we focus on that without ensuring proper elimination, right? So, this can lead to recirculation of toxins, increased inflammation, and worsening symptoms. Right. So we always want to make sure that those systems are open, those pathways are open, and there's a lot of different things we can do to support that. So, why does drainage come first? Right? Before supporting the immune system or initiating detox protocols, we must ensure the body can eliminate waste efficiently. So, if the terrain is congested, lymph is stagnant, bile is sluggish, kidneys are overburdened, right? Liver function is compromised, then any attempt to mobilize toxins will only overwhelm the system, right? Drainage lays the groundwork for safe, effective detoxification. So, whether you are a dental hygienist or a dentist, or I'm not even sure, there may be other people in here who are in different professions. This is something that we always want to be thinking about, whether it be periodontal therapy, smart removal, infection removal, so many different things. We always need to be thinking about how we're supporting the body's ability to clear, right? The body's drainage pathways occur through six main routes, right? We think of liver and bile, which filters blood, metabolizes toxins, release waste into bile. Kidneys excrete water soluble waste and metabolites. The lymphatic system transports immune cells and cellular debris, right? The colon eliminates bulk waste and spent hormones. The skin, sweat glands help remove toxins, and the lungs exhale carbon dioxide and volatile compounds, right? In oral health, all of these systems influence what shows up in the mouth. So we always want to be thinking of these. And when we think about how drainage impacts oral health, right, we can see back to those clues we can see in the oral cavity, we can see signs of impaired drainage. We can see a coated or discolored tongue, puffy or inflamed gums, chronic sinus congestion, swelling or fluid retention in the face, poor wound healing after dental procedures, right? These symptoms signal internal stagnation that needs support, not just local treatment. We also think of the liver mouth connection. The liver filters toxins from the bloodstream and plays a central role in oral terrain regulation. So, when it is sluggish, we may see things like bleeding gums, oral thrush, hormonal imbalance, which affects periodontal tissues, difficulty tolerating dental anesthesia or procedures. Supporting liver health is key to a healthy oral environment. The majority of our hormone conversion happens in our liver, also hormone clearance. So if we have a bogged down liver, we are going to see that impaired tissue integrity, right? We know that the liver is where we clear estrogen, right? Estrogen is one of those hormones that we utilize and then we want to clear, right? But if our liver is bogged down, we don't, right? So when we have that estrogen dominance variable, we're more likely going to see bleeding gums because estrogen regulates that circulation in the gum tissue. So there's a lot of different things that we think about there. We also think of lymphatic flow in the face, right? The lymphatic system is often overlooked in dentistry, yet it plays a crucial role in reducing inflammation, clearing waste, and supporting immune response in the head and neck. I feel like more and more people, especially if anyone's taken my course, I really harp on how important lymphatic drainage is. There are quite a few offices bringing it into their practice or referring out after treatment, which I think is so amazing, right? Blocked lymphatic flow can lead to swelling in the jaw or under the tongue. Right? Especially if we're removing infection or we're working with gum and periodontal disease, we want to make sure we're able to actually move the lymphatic system, or we're going to have a lot of that bacteria and toxins stay localized in our jaw, right? We want to be able to move that. Now, if we don't have a lymphatic practitioner to refer to, right, there's different things that we can do. Gua sha, different tools. There's Flowpresso is a tool. So there's different things that we can do, but I always recommend finding someone in your area to refer to. We can also see post-procedure inflammation that lingers, right? We can see that slower healing response, right? And we see that localized inflammation in the area of treatment. Facial lymph flow must be encouraged before and after dental interventions. We also think how the nervous system influences drainage, right? Drainage isn't just mechanical, it's neurological, right? A body stuck in sympathetic fight or flight mode won't drain properly, right? The lymphatic system does not have a pump. It relies on the diaphragm to start to move the lymphatic flow. So, if we're not breathing properly, if we're not getting that deep diaphragmatic breathing, we're going to have a stagnant lymphatic system. We also see muscle tension, fascial constriction, and shallow breathing, all slow lymph and reduce oxygenation in the body. So, creating that parasympathetic safety helps restore the flow. Some of those gentle tools, right? We can use castor oil packs over the liver or abdomen, facial gua sha or manual lymphatic drainage, dry brushing, rebounding. We can also think of things like bitter herbs to stimulate bile flow, hydration and electrolytes to flush the kidneys, right? These should always precede any major detox or chelation protocol, right? We want to make sure those pathways are open before we bring in any of these binders or different detoxification protocols. We can think about these terrain red flags when not to detox the body, right? We don't want to initiate detox protocols if the following are present: chronic constipation, fatigue after sauna or sweating, skin breakouts post supplement use, symptoms worsen after cleanses, metallic taste in the mouth, right? These are signs that drainage isn't sufficient and the terrain needs foundational support first. We think about supporting patients before dental surgery, right? Drainage preparation is critical before procedures, whether that be removal of infection, cavitation surgery, removal of wisdom teeth, smart removal, right? We want to think about how we're supporting liver drainage, lymphatic movement, mineral support, nervous system regulation, digestion, breathing, right? All of these different things. This improves healing and reduces any type of post op symptoms. And we also think of post procedure terrain recovery. After a procedure, the terrain is vulnerable, right? So to support recovery, this is where we might want to bring in the use of binders to catch circulating toxins, continue liver and lymph support with antioxidants, things like vitamin C and glutathione, emphasize rest, hydration, light movement, right? Avoid aggressive detox right after surgery. Let the body stabilize first. You can't detox your way to health unless your body knows how to eliminate. So, drainage, right? It's a biological necessity. And in dentistry, it may be the missing link between a procedure and full body healing. Of course, we also think of oral and airway health integration. The airway is part of the terrain, right? It's not just a structural concern, it's a terrain concern. Mouth breathing, low tongue posture, and poor nasal function all disrupt the body's internal balance, right? So we can see altered oral pH, more acidic, low nitric oxide bioavailability, so increased susceptibility to pathogens, poor oxygenation, which impairs healing and energy production. So structure dictates function. Underdeveloped jaws, restricted tongues, and high palates are more than cosmetic issues, right? These structural changes narrow the airway, disrupt sleep and oxygen levels, increase nervous system activation in survival mode, contribute to oral dysfunction and stagnation. Posture, tongue position, and cranial strain directly shape the terrain. Right? Myofunctional therapy as terrain work, right? Myofunctional therapy supports the terrain by restoring nasal breathing, improving vagal tone, increasing saliva production, and strengthening facial and tongue muscles to support airway tone. We also think of oxygenation and cellular healing. Every cell in the body, including the gums, jawbone, and oral mucosa, requires oxygen to function and repair. So, chronic hypoxia, low oxygen from poor airway function, can contribute to fatigue and brain fog, delayed wound healing, increased biofilm formation, and oral infections and inflammation. Right? We also think of nitric oxide. I touched on this a little bit. The antimicrobial molecule. Nitric oxide produced through nasal breathing has powerful systemic effects. Of course, vasodilation, better circulation to the tissues, antibacterial and antiviral effects, improved mitochondrial function, and enhanced oxygen uptake and delivery. Right? So mouth breathing reduces nitric oxide by 50% or more. So that's why, that myofunctional therapy encouraging nasal breathing is essential. We can also see how airway impacts mineral status. Poor sleep from airway dysfunction leads to increased stress. Stress leads to increased mineral loss. Mineral loss leads to worsened oral environment, right? We see this cascade often in clients with sleep apnea, clenching and grinding, narrow palate, or open mouth posture. Terrain work must include an airway evaluation. We also think of restoring structure and function together. To restore oral systemic terrain, we address both structure, tongue posture, myofunctional therapy, bodywork, jaw support, breath training, vagal stimulation, mineral replenishment, and hydration, right? The dual approach creates lasting change and stability. We also think of pediatric terrain, future resilience. The earlier we support airway health, the better. In children, mouth breathing, tongue ties, and poor sleep can disrupt terrain formation for life, right? So early intervention leads to improved facial development, better immune function, healthier teeth and bone density, reduced need for orthodontics or surgery. We think of mouth body mapping in terrain based dentistry, right? Every tooth, and I'm just going to touch on this, every tooth is connected to an energetic meridian that influences body systems, right? A disruption in one area of the mouth can ripple through the whole body, right? Certain teeth are linked with digestion and immunity, leading to chronic issues. Here may show up as bloating, fatigue, or lower defenses. Others connect to thyroid and metabolism. Stress in these areas can influence energy, weight balance, and mood. Right, we can also see them affect the heart and circulation, the nervous system, right? So when we include the energy pathways into our care, right, we expand beyond the mouth, right? We start to really become multidimensional and really are thinking of the whole body, right? So how can we actually bring it all together, the terrain-based model? Right. In a terrain supportive practice, we assess mineral status, nervous system state, symptoms and tissue tone, drainage pathways and detox readiness, oral and airway structure, functional breathing, movement and breathing. Right. This allows us to really create the most personalized root cause care. I think if we start to miss some of these, we aren't really getting that full picture. So, when we recap the four pillars of the terrain based healing to truly support airway health, we must address the terrain using systems based approach, mineral balance, the foundation for energy resilience and pH buffering, nervous system regulation, right? Healing cannot happen in survival mode. Drainage and detox pathways, open the exits before mobilizing toxins, and structure and airway function, posture, breath, and tongue tone shape internal terrain. So, some clinical takeaways that you can start applying today, right? We can begin every healing protocol with an assessment, right? If we aren't able to do mineral testing, I think something really big that we could do is look at the medical intake. What medications are they taking, right? And I have a handout. Maybe I'll give it to Heather to give to you all, which has the most common medications and what they deplete the body of. And so I think that is a really important step. So if you don't have access to mineral testing right away, let's start by looking at what the body is being depleted of that it needs. That is essential. We can also assess the nervous system state. Sometimes we can just assess that by talking to our patients, even on that first phone call to the office, right? There's a lot of different things that we can assess, but if we do have access to that HTMA testing, I think it's a great thing to bring into practice. We want to make sure that we're always supporting drainage before considering detox or surgical procedures. We want to absorb the mouth for signs of internal imbalance, coated tongue, gum inflammation, dry mouth, poor healing. So many different things can really show up in the mouth before any diagnosis, right? We are that first line of defense. We also want to consider airway structure and function in all chronic oral health cases. And really remember that the terrain determines the outcome, not just the procedure, right? So if you ever had a procedure that didn't go as expected, the healing wasn't optimal, right? Or we had delayed healing in the area, or an implant didn't take, or we didn't have the outcome after periodontal therapy that we thought, it might not be the work that we did, right? The clinical work could be beautiful, but those cases where everything was done right, but still didn't heal properly, that really brings us back to the terrain, right? So if we can support this before procedures, we're going to have much more predictable and optimal healing outcomes. And really, for the patient's care, right? This model empowers clinicians to create more sustainable outcomes with fewer setbacks, reduce patient sensitivity and healing complications, build deeper trust by treating the whole person, not just the tooth, and contributes to true health restoration, not just disease management, right? You're not just delivering dental care, you're guiding transformation. And our patients are an active participant in that. And when we actually start to bring these other facets into their healing, they really do get involved. So I know that was a lot. I was trying to make sure I got through everything, but I just really appreciate everyone for being here and being open to these concepts. If you have any questions, Heather, if you wanted to field any questions or if anyone wanted
Yeah.
to unmute themselves, I'm happy to answer anything.
We have questions in. There's a few that I have written down. One of the questions was, does an electric toothbrush stimulate the vagus nerve?
It can. Yeah, it definitely can.
And then another question I had about the drainage pathways. Who are good referral specialists that we would be looking for? What's those specialists? A massage therapist in lymphatic drainage? What do we look for certifications and who are good referral options for us to refer to for the lymphatic drainage?
Yeah, for lymphatic drainage, exactly. It's going to be a lymphatic massage specialist. We could also refer to myofascial release would be another great option. But I would say finding those people in your area, I would find someone that's great at myofascial release, someone that's great at lymphatic drainage. I mean, I think one of the biggest things, and I know you talk about this too, is collaboration, right?
Yes.
If we really want to support our patients' optimal health, we need to build this network, referral network of providers. So we should have naturopaths and functional doctors in there, chiropractors, body workers, right? So those are all things that we can think about. There are some estheticians who are trained in buccal massage, which is great for the work that we're doing. So especially if we have those patients or clients with TMJ, pain, dysfunction, having that like buccal massage, they're harder to find, they're harder to come by, but it is definitely up and coming.
And in the Saliva Sleuths community, I do have a referral section that we're building out for you to have some good referral options for you, depending on what you're looking for. Another question about the mineral testing. So, how do we get access to mineral testing, and what is something that dentists can, or is it something that dentists can order? I know you do a lot of the mineral testing, you're doing hair mineral testing, there's some courses. Can you give us some ideas of how we can get some training on mineral testing and reading that? Of course, make sure that you mention your program.
Yeah. So mineral testing, there's a few different ways that you can go about it. So, yes, I do run mineral testing on my clients. As a dentist, you are able to, in a lot of states, as a hygienist, you're able to run that as well. Some states do require a nutrition certification or a health coaching certification in addition to. So, that's something that you can look into in your state. So, you can work with a provider who does the testing and you refer out. So I do have quite a few dentists refer their patients to me, and I'm able to prepare their patients before and after treatment. You may want to work with someone locally in your area, right? That might be a functional doctor. A lot of times, like an FDN is a great option. They're going to most likely run mineral testing. And then also if you want to run it yourself. So I do have a course called Beyond the Mouth, and that is part of the curriculum is learning how mineral testing impacts the oral cavity and how we can interpret those results to support our patient's healing. I really focus, I do talk kind of all the different layers of the HTA testing in that program, but my real emphasis is how we can use it in dentistry. There are multiple courses that I have taken to learn how to interpret it. There's a Test Don't Guess course, there's with Jensen and Kendra Perry. There's a few different people, and I'm happy to share like those. That's kind of where you would learn how to fully interpret that test. I will say the one thing that comes up a lot with any type of functional testing is they aren't all diving as deep into the oral health component, which is part of the reason I created my course to really tie in those links because our mouth is one of the most mineral rich and mineral dependent areas in the body. So those are kind of all options that you could explore.
Awesome. Thank you.
Yeah.
Amelia, did you have any other questions following up that? Feel free to unmute if you're still. Amazing. Thank you. No, she's good. Any other questions? Feel free to unmute. I am a conversationalist, so if you have a question, feel free to unmute and ask.
Hey guys, I'm gonna ask one about sodium.
Yeah.
I don't know why, but I have had so many ladies that are low on sodium. And I mean, to the point where one of them had to scrub a surgery. It was so low. So besides adding salt, is there anything that I can help recommend for them? Anything I should watch out for?
So if we see really tanked sodium, I'm immediately thinking about stress.
Hmm.
So if our patients are very stressed, whether that be physical, emotional, any type of level, we're going to become really depleted in minerals. So the
Hmm.
nervous system regulation is going to be key. But also, we do want to make sure that they are getting enough sodium. So whether that be through electrolytes, trace minerals, adding sea salt to water, right? Because we know we need sodium for that cellular hydration.
Hmm.
So if we're just drinking water and without any minerals, right, we're getting even more depleted in the sodium as well. So of course, we don't want to get sodium from preservatives and processed food. We want to get it from natural food sources. So we can think about things like incorporating bone broth, or different food sources of sodium versus like adding a ton more sodium to our food. But I'd always be thinking about stress and nervous system with that.
That resonates, the stress
Yeah.
part. Yeah, because they are all patients that are very, very stressful moms and concerned about their families and, caregivers. So these are ladies that, as you said that, I was like, oh, yep, that's exactly them. So that makes sense. Hmm.
So, I mean, and there's so many things, like I said, that we can do for our nervous system. Sometimes, even in that case, I love something passive. This is
Hmm.
something that I love, and I can share a link. It's called an aura box. It's like a
Hmm.
$40 frequency box that we can put on in the background that helps calm our nervous system and kind of calm our body and allow it to feel safe. I recommend it a lot because it's just inexpensive. There's no Wi-Fi connected to it. You can keep it on your bedside table before you go to sleep. Helps with deeper sleep. It just helps to kind of calm the body. You can play it in the background very low. And I feel like that's just like a nice passive tool. Um,
Hmm.
if we have those people who are just like always on the go, taking care of everybody else, like if they're not going to sit down and do breath work and they're not going to, start EFT tapping, but we can put something passive in their life that's going to calm their body down, I'm all for that.
It's a great idea. Thank you.
Of course.
For a box. Awesome.
Yeah.
Any other questions? Feel free to unmute and ask.
I'm curious about red light intraorally, aside from just nervous system regulation, and also alongside that, blue light intraorally, given the antibacterial component.
Yeah, I love both options. Of course, for nervous system regulation, but red light does stimulate mitochondrial function and ATP production. So it's going to bring more energy to heal faster. There's a lot of studies in the use of red light for increased salivary flow. So patients who have that decreased saliva, dry mouth, even those patients with like Sjogren's syndrome, autoimmune disease, it's a great addition. So I would use it on anyone who's going through any treatment. I would use it on periodontal therapy, surgical removal of infection. I really would use it on just about anybody. And blue light for that antibacterial effect. I think it's amazing.
Oh, you're speaking my language. Sjogren's over here.
Oh,
And
yeah.
what are some good at-home therapies we could recommend for patients for a red light therapy device?
Um, so there is this wand. Like I said, I can share links to these things for you. Um, Usui has this very reasonable wand. It's like $150. It's just such a nice little at-home tool. You can shine it outside the mouth, but also intraorally. Like I said, there's so many companies now. If we want to get like the red light panels, I feel like the easiest thing and like the most inexpensive thing is like a wand. But if we want a panel, there's like the small Juve red light panels. I like Bond Charge has great red light options, Mito red light. But I feel like when I started, there was just like EMR Tech was like the big and Juve. And now there's like 1,000 companies. But yeah, I can share links to some of my favorite ones, but the price range is so drastic between them. So I was just thinking about what makes sense for everyone.
Great. Well, then, thank you. I think this wraps up all the questions. If you are new in the group and I do not have your email and you want a follow-up of this recap, make sure to drop your email in the chat so that I can make sure that you get the recording. I want to make sure that you get the recording, and I'll make sure to share any of the links that she shares with me. Amazing. Go ahead.
I have one more. Apologies if you already addressed this. What are your thoughts on oral microbiome testing? I know the GI map is big for the gut, but a test like bristle.
I love it. I absolutely love it. I work with that test all the time. I think it's important, right? The bacteria are so important when it comes to bringing all the pieces together. And bristle is my favorite one to recommend. I think it's the most comprehensive and really gives us the best data. So there are plenty of tests. I mean, I think any test is a good option, right? I think we should always have a baseline for our patients. So yeah, I love it. Always recommend it.
Yep. May I ask who asked that question?
I think it was Marianne.
Marianne. Okay. Marianne, just FYI, I am the clinical trainer for Bristle Health. So that's where I got everything started on my Saliva Sleuths journey. I do all the clinical training for Bristle Health salivary testing. The Saliva Sleuths community is basically all information, oral microbiome based, diving into salivary testing results, understanding microbial makeups, and exploring different ways to help improve that process. So that's where I got started, is salivary testing. But I oftentimes teach that we have to look at the whole picture, which she recapped beautifully today, that we have to look at the terrain. What's going on? Do I have enough saliva? What's going on with my patient that's making the dysbiosis happen to begin with? Because we really can't shift the oral microbiome unless we're paying attention to the host. What's going on with the host that's making them susceptible for the dysbiosis to start? So I love the marrying of the terrain and what's actually going on microbially. There's certain bacteria like Prevotella that will be more virulent with the presence of estradiol. If anybody else has any concerns or questions, reach out. Amber, did you share your socials with everybody?
Oh, you can, if you did have questions that come up after, just naturally Amber White on Instagram is the quickest way to get a hold of me.
Perfect. Awesome. Wonderful. Thank you so much for coming in. I
Thanks
hope
for-
everybody enjoyed the evening. Thank you so much. I appreciate you all.
Thank you.